Just think about the potential that's here, you know, building on all the expertise that's here in this room, and that's what I'd really like for us to do. Anyway, that's enough for us to get started. I think we need to sort of dig right into the meat of it, and we're going to hear from Pat O'Shea, who's going to set the stage about why we're focusing on seniors' care. I was to introduce you, but you said everything that I was going to say, except what you don't probably know is that he graduated from Queen's University in 1980, and completed his family medicine residency at Memorial before he started his practice here in 1982, so he's been around for a while. The other thing that you may not know is that he was honored to be named Newfoundland's Family Physician of the Year in 2007. So welcome, and the floor is yours.
A 75-year-old man has Parkinson's disease. He's being cared for at home by his wife and married daughters. He has frequent falls. Despite efforts to find a reliable and suitable home care worker through agencies and advertisements in the paper, they've had no success. After another fall in the middle of the night, he has no option but to be admitted to a nursing home. A 70-year-old female with severe arthritis developed symptoms of a urinary tract infection at 7 p.m. one night. She spends 5 hours in St. Clair's Emergency waiting for a prescription for antibiotics. An 82-year-old woman falls at home, breaks her hip, and is admitted to the Health Sciences Center for surgery. There she develops a urinary tract infection. Later, she develops pneumonia, becomes quite agitated with an undiagnosed delirium, and is heavily sedated. She is now one of the 80 people in our 2 acute care hospitals awaiting placement in an institutional bed. Ladies and gentlemen, these are real patients of mine, and every doctor, nurse, and social worker in this room could add their own stories of patients, friends, and relatives in the final years of life who have had to endure physical or emotional pain waiting for treatment and care. It is hard enough to wait for tests and surgery when you are young. How much harder is it for an 80-year-old with limited mobility waiting 18 months for a knee or hip replacement? The emergency departments are crowded, and many elderly will avoid going there at all costs as they know what they will have to face. Few family doctors have evening or weekend clinics or an answering service so they can be reached for telephone advice. Home care is hard to get, restricted in hours, with very little hope of ever seeing an occupational therapist or physiotherapist. Nursing homes are forced to reduce staff to solve budgetary problems at the same time that sicker people are being admitted. Healthcare providers are overworked and too busy to give the extra time that many seniors need. Mental health services are overwhelmed. We have to do better. The current medical system does not serve seniors well. Some would argue that it doesn't serve younger patients well, but that is a debate for another time. Our province's present-day health services, especially in long-term care and community support, have developed over many years, usually in response to specific needs. There was no master plan and no coordination, resulting in a patchwork of services, unfortunately with some holes in the fabric. Such a system worked fairly well when the number of seniors was low and budgets had some discretionary leeway for the inevitable exceptions. In addition, this province traditionally had many seniors living in small communities being looked after by extended family and friends with little reliance on government and strangers. Times have changed. There has been increased urbanization, more out-migration of family members, and a greater need for public health agencies to provide services. As we all know, the number of seniors is dramatically increasing. In 2006, about 13% of our population was over 65. That figure will rise to 20% by 2016, and then 25% by 2025. That is 1 in 4 Newfoundlanders and Labradorians. Putting it another way, an estimated 125,000 people in this province will be older than 65 by 2025. Our province will then have the highest percentage of seniors per capita in this country. At the present time in Newfoundland and Labrador, there are about 4,000 people in personal care homes and about 2,500 in nursing home beds. Will these be enough beds when we have 125,000 citizens over 65? If we all think we are seeing a lot of older patients now, it will become even more noticeable during the next 10 years. You might ask, why start thinking about this problem now? My response is, it may already be a little late. It will cost the medical system in the province greatly to ignore these demographic warnings. To do nothing is dangerous and not really an option. We must make suggestions now to benefit us all in the future. It takes time to properly lobby governments, and sometimes it is difficult for our elected members to look far into the future, or at least any farther than a 4-year government mandate. It also takes a long time to plan and build the necessary infrastructure, as we have seen with the new nursing home being constructed in Pleasantville. I'm pleased that our provincial government has acknowledged the reality of the coming population changes. Last fall, meetings were held around the province looking at the seniors issue. Government received a lot of information from all involved with seniors' care, from family members and seniors, health groups, social agencies, and advocacy groups. Everyone acknowledged we have to do better, with better coordination to prevent gaps in service. How that will be achieved, however, is not clear. I do not envy the Department of Health. It is a gargantuan task to coordinate a plan for more appropriate care for the elderly. It is also going to be expensive. How we pay for it, of course, is another unknown. The current provincial health care budget was about $2.2 billion. Just 10 years ago, it was about $1.2 billion. Can we anticipate yet another billion-dollar demand for health care dollars in 10 years? How might seniors' care compete with the need for more expensive diagnostic tests and machines, or ever more expensive medications and treatments, or increased human resources, or even better roads and sewage treatment plants? This is why it is crucial to focus on seniors' care. We have to address the issue head-on to plan for the future. Ignoring it will not make it go away. Ignoring it will mean more expense, more suffering, and more frustration for seniors, caregivers, and health providers.